Good afternoon. Thank you for joining us for today's webinar, Preparing for Phase 1 of the CMS Vaccine Mandate. December 5th is fast approaching. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those of you who have provided us with your unique NAB number, and I will be sending attendance certificates. A survey will be launched at the close of the webinar. Your feedback is important to us and our speaker, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the questions pane on the right hand of your screen, and our presenter will address them at the end of the presentation. Today's webinar is being presented by Paula Sanders with Post & Shell and the PHCA regulatory team for an interactive discussion. I'll now turn the webinar over to Paula.
Wendy, thanks so much, and good afternoon, everybody. I hope you're enjoying the beautiful weather. Today, we just want to spend a little bit of time talking to you about the new Interim Final Rule from CMS requiring vaccination mandates. And we'll also talk very, very briefly about the OSHA ETS for large employers or employers of more than 100 employees. But I wanted to just do a sort of a refresher for you and review the timeline, because there's been a lot of federal COVID-19 requirements. I want to look specifically at the ones coming from OSHA and the executive orders, particularly related to COVID protection, right? So we've talked at length about the OSHA emergency temporary standard that was called the Occupational Exposure to COVID-19 Emergency Temporary Standard that came out in June of 2021. I just want to refresh your recollection. That's the one that has all the requirements about physical barriers, about reporting COVID infections and deaths and hospitalizations, keeping the COVID-19 log separate from the OSHA 300 log. And that applied to healthcare providers, but it also touched upon personal care homes and assisted livings, if you recall. Interestingly, the temporary standard that came out in June 2021 is set to expire unless they renew it or turn it into final regulations by December 21, 2021. And it's an important thing to keep in mind. It'll become apparent to you why in a few minutes, but just keep that one in the back of your mind. Then we go to September 9th. The executive branch, President Biden issued 2 executive orders affecting mandatory vaccinations for federal employees and federal contractors. And now we come into November. OSHA and CMS had announced that they were coming out with vaccination mandation requirements. We all thought things were going to come out in October. You may recall waiting with bated breath, checking emails to see what was CMS doing. They didn't issue anything until November 4th. Today's the 11th, so it's about a week ago. CMS issued what's called the Interim Final Rule that applies to Medicare and Medicaid certified providers, and that has a mandatory vaccination requirement. And at the same time, OSHA issued its emergency temporary standard that has an impact on employers who have 100 or more employees. And unlike the CMS regulation, the OSHA ETS gives a testing opt-out, right? You can, if you're an employer of more than 100 people, you have to have either a mandatory vaccination, or your employees can choose to get vaccinated or to mask and test. And we'll talk about those differences towards the end of this presentation. Keep in mind, though, that all of these requirements become effective when staff have to be fully vaccinated by January 4, 2022. The new vaccination mandate, the CMS one, applies to all Medicare and Medicaid certified healthcare facilities. It allows for limited medical and religious exemptions, but there's no testing opt-out. The regulations for federal workers and federal contractors were issued, as I mentioned, by executive order. And then we have this third one, the ETS, that just came out. The ETS, as well as the Medicare and Medicaid CMS rule, have provisions in there that state that those regulations, particularly since we're going to talk about CMS, these are going to preempt any state law that is not as stringent. So not an issue in Pennsylvania because we don't have a statewide mandation, but in a state like Texas or Florida, this rule would take priority. It would preempt the lesser standards. Now you can imagine that has not gone over really well. And just yesterday, 10 states filed a federal challenge to the CMS rule. Those states are Missouri, Kansas, Nebraska, Arkansas, Iowa, Wyoming, Alaska, South Dakota, North Dakota, and New Hampshire. However, the likelihood of these states being successful ultimately, I think, are pretty narrow or dim, because CMS really paid very careful attention to how they were exercising their jurisdiction for this interim final rule. That does not apply to every single Medicare and Medicaid certified provider. It only applies to those providers and supplier types that are regulated under Medicare's health and safety standards. So for instance, hospitals have their conditions of participation. Skilled nursing facilities have the requirements of participation. But personal care homes, for instance, aren't covered. Assisted living, even if they in some states are Medicaid certified, they're not covered because CMS doesn't govern their health and safety standards. So keep that in mind when you're talking to staff. I know there's been a lot of confusion about who does this apply to, but it's very, very carefully crafted in terms of its application. And I think they did that intentionally in anticipation of potential litigation. As of today, there have been no cases in Pennsylvania filed against the CMS interim final rule. There have been a number of lawsuits challenging OSHA's large employer ETS. The Fifth Circuit Court of Appeals has issued a stay prohibiting the implementation of the OSHA large employer ETS. We expect a decision on that pretty soon, and I expect it will make its way up to the Supreme Court. Don't know how it's going to turn out, because OSHA, as they did when they issued the first ETS that affected healthcare providers, made a finding of what they call grave danger. Not sure that that's going to be strong enough to withstand this challenge, but we are advising people who are covered by the new ETS to start preparing for implementation just in case. And you can see almost half of the states in the country, I think the last count I saw was 24, 24 different states have challenged this emergency temporary standard. Pennsylvania is not one of them. It's by way of background, I know that was a question that somebody had asked prior to the presentation. I'm going to spend the next several minutes talking about the CMS Interim Final Rule. They've broken the compliance deadlines into two phases. Phase 1, December 6, 2021, or, for realistic purposes, is really December 5th. And phase 2, January 4, 2022. One is 30 days from the date of publication. The other, phase 2, is 60 days. And what do you have to do? Because everyone on this broadcast today is a skilled nursing facility. You are covered, right? This means policies and procedures have to be in place by the end of phase 1. You have to have policies and procedures about what you're doing about granting exemptions, accommodations, and how you're tracking vaccination status. More importantly, all of your staff have to have the first dose of an approved vaccine, or they have to have pending or been granted a lawful exemption by December 6th, right? 12:01, the morning of December 6th, which is why I've been saying 12:05, right? If they don't have their first dose, or they haven't requested or been granted an exemption, they're not going to be able to provide any care, treatment, or other services. By phase 2, January 4, all staff have to be fully vaccinated unless they've been granted an exemption, or if their vaccination must be temporarily delayed for clinical reasons. And that temporary delay could be that they're not able to get the vaccine, for instance, because they have an active case of COVID. The regulations do identify those reasons for delay due to clinical reasons based on CDC guidelines. All new staff have to be vaccinated come January 4. You can't bring on anybody if they're not vaccinated or been granted an exemption. It's just going to be the end of the line for them. I know many people are very nervous about what that is going to do to staffing. CMS, as recently as yesterday, on a webinar they provided, very cavalierly said they don't think there's going to be any staffing impact. I don't know that they've talked to those of you who have facilities in some of the more rural areas of Pennsylvania, or even in the urban areas, because everyone is having significant staffing issues. We're going to talk about some ways that you may be able to address that while still complying with these vax mandates. Who's covered by this IFR? As I mentioned, these are the providers who are subject to the health and safety oversight of CMS. The whole host of different kinds of facilities, including intermediate care facilities for individuals with intellectual disabilities, PACE programs, end-stage renal disease facilities, home health agencies, hospices, hospitals. This is the comprehensive list. If the provider type is not on this slide, they are not immediately covered by the interim final rule, and I'll get to what that means in a second. Here is where CMS has, in the eyes of some of the states who have challenged the regulation already, This is where we think there's been a little bit of overreach because the vaccine mandate applies to staff regardless of their clinical responsibility or patient contact. So it's any staff who provides any care, treatment, or other services for the facility and or its patients or residents. Easy to say, that's those folks who are directly employed, the facility employees. But it also affects all of your licensed practitioners, students and trainees, and volunteers. And I copied out of the preamble to the regulation some of the examples that CMS gave just to give you a full feeling for how comprehensive CMS is intending this reach to be, right? Administrative staff, facility leadership, volunteer or fiduciary board members, housekeeping and food services, and others. Individuals who provide care, treatment, or other services for the facility and or its patients under contract or other arrangement, and all staff that interact with other staff, patients, residents, clients in any location beyond those that physically enter facilities, clinics, homes, or other sites of care. Just think about that for a minute, right? If you are a continuing care retirement community, and you have a personal care home, you've got independent living, and you have staff who cross into all three settings, those staff, even if they're primarily working in a non-covered part of your campus, are going to be required to be vaccinated under this regulation if they interact with other staff or other patients or residents. So it's a very broad, far-reaching interpretation of staff. Are there any exceptions? Absolutely. Employees who exclusively provide telehealth or telemedicine services outside of the facility, and they have absolutely no direct contact with your residents or other staff. Employees who provide support services performed exclusively outside of the facility with no direct contact with residents or other staff. Individuals who infrequently provide ad hoc non-healthcare services. For instance, the folks who come in and do your annual elevator inspection, or services that are performed exclusively off-site, not at or adjacent to any site of patient care. So for instance, if you have an administrative building and that's where your accounting services are, and there's no crossover, those folks don't go into your healthcare center for food. They don't go to the vending machines. They just never enter that building. They never see patients. They never see any staff who work in your healthcare center. Those people would not be covered. As CMS recognizes that you have other individuals who infrequently enter your facility for specific limited purposes and for a limited amount of time, but they don't provide services by contract or under arrangement, such as delivery and repair personnel. What does that mean? Though, if I have a food vendor who pulls up to my loading dock, doesn't come in, drops off the food and leaves, maybe I can say I don't need to have that person tell me about their vaccination status to determine if they can continue coming into the facility. But let's say they do come in, right? And they are helping to load food into your refrigerators and they're walking into your pantries. They probably would be expected by CMS to let you know what their vaccination status is. Say I have somebody coming in to fix my HVAC system. Well, if they're just coming in once and done? Probably not. But if they're coming in because I've got a major problem and they have to walk through my patient care area to get to the main unit, and they're going to be in my building for 3 days, CMS is going to expect you to get information about their vaccination status and determine whether or not they can come in to provide that service. So let's look at some other examples here. Transport and emergency medical services. They're not a covered entity under the IRF, right? They're not subject to the CMS health and safety regulations. However, they have to be vaccinated if they have a professional relationship with you. So your transport folks are going to need to be vaccinated under this rule, even though their company may not be covered. The fact that they are crossing into the threshold of a CMS regulated healthcare entity would trigger. Pharmacies. The regulation applies if the pharmacies go on site to covered facilities. Retail pharmacies, by contrast, are not covered. This is under the CMS IRF. Somebody asked a question before the webinar, what about the fire department? The fire department isn't really coming in to provide services to the residents. And I think it would be hard pressed to say that your local fire company is going to have to be vaccinated before they can come into your building on an emergency. But again, contrast that with the emergency medical services folks who are actually coming into the building, picking up your residents and taking them out. And most of you do have arrangements with EMS providers to provide those services. Notably, CMS has stated that they will be issuing new guidance for surveyors that will mirror the requirements of this interim final rule. And that's a significant movement, right? We have not been allowed to ask surveyors if they're vaccinated. This rule will require them to be vaccinated or to have been given an exemption. The CMS expects you all to be doing a case-by-case determination for your vendors and contractors, those ad hoc folks we were just talking about. What has not been clarified is the question, and perhaps I'm trying to think of a good example. Let's say you have a contracted therapy company that you're working with. And the therapy company has granted an exemption. Your therapist comes into your facility. There are some people who are saying you need to make your own assessment as to whether that person's exemption from another employer works in your location, right? Because I may have a different standard for granting a religious exemption than you do. So that is not clear in terms of what the surveyors are going to do with that. You may want to start thinking about, what are you going to say in your policies? Most disappointingly, I think, for your standpoint, is these rules do not apply to visitors. You can't ask them to be vaccinated. And I think that's a huge hole in our whole infection prevention and control process, because families can be bringing this stuff in and we have no way of knowing them. We can't test them. We can't ask them. The most we can do is screen them for signs and symptoms and hope that they're being honest about their potential exposure. But it's a big problem from my perspective in the way the rules have been written. So I mentioned exemptions. I'm going to spend a few minutes talking about them now. There are two kinds of exemptions. There are medical exemptions under the Americans with Disabilities Act and religious exemptions under Title VII. Medical exemptions is a very clear-cut process. The regulations have very specific requirements, and you have to provide accommodations for individuals with medical conditions or disabilities. You have to have a process in place to allow them to apply for the exemption, and you have to grant them a reasonable accommodation unless doing so creates an undue hardship or poses a direct threat to employees or others. Undue hardships and direct threat include an analysis of the type of industry and workplace, job duties, and other safety considerations. So, and I'm going to talk in a minute about the information that you must get on your medical exemption forms. The religious exemptions, by contrast, are much looser, right? You have to give them an opportunity to request a religious exemption, and you have to have an accommodation process based on an analysis of the employee's sincerely held religious belief, practice, or observance. This includes traditional organized religion, as well as uncommon, informal, unorganized beliefs, and beliefs that may seem illogical or unreasonable to others, as long as it's not a political belief, right? If it's tied into some sort of religious undertones, even if it's contrary to the teachings of established religions. The example I would use there is Catholicism. The Pope has come out in favor of the vaccinations. It's a moral obligation to get vaccinated to protect others. There have been statements from the church saying that there is nothing that the Catholic religion prohibits with respect to the vaccinations and how the vaccines have been made. Notwithstanding that, you may have an employee come to you and say, I have a sincerely held religious belief. I'm Catholic and I just cannot take this vaccine. It is against my sincerely held religious belief. And, God will strike me down if I do this. Well, even though that's contrary to the established position of the traditional church, if it is the employee's sincerely held religious belief, you might be able to accommodate that. You may deny requests for religious exemptions if you determine that it's a sincerely held religious belief, but to accommodate them might present an undue hardship. And that means the accommodation is more than a de minimis cost. You can look at the monetary cost. You can look at the burden on your business, reduced job performance, impinging on other employees' rights, or if it impairs workplace safety. And we'll come back to religious exemptions in a minute. The regulations provide very specific guidelines on the information you have to have on your request for medical exemptions. A medical exemption has to have documentation confirming recognized clinical contraindications to COVID-19 vaccines, and they have to support the staff member's request. The exemption has to be signed and dated by a licensed practitioner who is not the individual requesting the exemption and who is acting within their respective scope of practice. The request has to contain all information specifying which of the authorized COVID-19 vaccines are clinically contraindicated for the staff member and the recognized clinical reasons for the contraindications. Finally, you have to include a statement from the authenticating practitioner recommending that the staff member be exempted from the facility's COVID-19 vaccination requirements based on the recognized clinical contraindications. The contraindications are set forth. There are not a lot of them. Most people who are going through this process now are involving their medical director or another physician as part of the review team for medical exemptions. Most of the exemptions that people are receiving, however, are not medical exemptions. Instead, they're requests for religious exemptions. And unlike the medical exemptions, where CMS identifies a number of different things you have to have, they have no required forms. There's no specific proof that you need. You have to ensure that the requests for your religious exemptions are documented and evaluated in accordance with applicable federal law and as part of your policies and procedures. These are person-centered inquiries. They have to be case by case. It's not a blanket. You can't say, we're going to accept this category, we're not going to accept that category. Even if you've accepted my belief and my coworker comes to you and says they have the same belief, you're not required to grant their request even though you granted mine. CMS said, here, look at this federal template. The first one is from the Safer Federal Workforce. This is the religious exemption request form that federal contractors are supposed to use. And then you can contrast that with the template that the EEOC has recommended. You'll see there are two very different approaches. One is much more directed toward deep inquiry into past practices, for instance, than the other. So what's a sincerely held religious belief? You have to assume, according to the EEOC, that a request for religious accommodation is based on a sincerely held religious belief. You don't leap to the conclusion that it's not sincere. We're not supposed to really delve into whether it's a sincerely held belief unless we have an objective basis for questioning either the religious nature or the sincerity of the particular belief. And if we have that, we can have limited factual inquiry. Has the employee acted in a way that's inconsistent with the claimed belief? Is the employee seeking a benefit or exception that's likely to be sought for non-religious reasons? Is there something questionable about the timing of the request? Do you have reason or other reasons to believe that the employee is seeking the benefit for secular reasons and not religious reasons? So here's a couple examples. I had COVID, so I'm immune and do not need to be vaccinated. That's neither a religious nor a medical reason. You would deny that request. The vaccine has microchips. Not a valid request. I might not be able to get pregnant. Not a valid reason to grant an exemption. My body is a holy temple and I cannot desecrate it with any vaccines. We've seen requests like this. I don't know if you've gotten any yet, but that may be a legitimate sincerely held religious belief. Maybe, maybe not. Again, case by case determination. As I say, granting one request for religious accommodation does not mean others have to be approved on the same basis. We'll come back to the exemptions in a minute, but what's a reasonable accommodation, right? CMS's goal is to reduce transmission of COVID-19. Unlike with the OSHA ETS, they haven't said anything other than we don't think testing is sufficient. That's why there's no testing opt-out. You have to be vaccinated. If you're not vaccinated, here are some of the things you should be doing: testing, source control, physical distancing. Because you're all in healthcare settings already, I would suggest that your source control include N95s, face shields, and goggles anytime they're in the building. Now, this one is really one of my favorite non-feasible, really CMS, you do not know the facilities you're regulating. Assign all of these folks to non-patient care areas with low risk when possible. That would be great if you were all overflowing with extra staff, but you're going to want your staff to be able to work if you're granting them an accommodation. Some may be able to telework, some you may be able to reassign. The important thing to keep in mind here is it's unlikely that surveyors are going to second guess the religious exemptions, right? There's a lot of room to evaluate whether someone is asking for a sincerely held religious belief to be accommodated. I would suggest to you, if you are at 40% vaccination and you gave religious accommodations to the remaining 60% of your staff who did not want to get vaccinated, I think somebody's going to look at that and really question if you were going through the process to make a determination. On the other hand, if you have a smaller percentage of staff who have come to you with sincerely held religious beliefs that are not things like, I'm not taking this vaccine, but are couched in language that looks like a sincerely held religious belief, you may be able to accept that on a case-by-case basis. So keep in mind what you can do in terms of that reasonable accommodation. Where do you keep these records? These vaccine records are considered to be medical records, obviously not governed by HIPAA, unless you are also providing the screening and the testing. But generally, the vaccine documentation has to be kept confidential under the ADA and Title VII and stored separately from the employer's personnel files. You have to have a process for collecting and evaluating your exemption requests. Include in that tracking and secure documentation of information provided by staff who have requested exemptions, what your decision was on that request, and any accommodations that are provided. You're going to have to make sure as well that you have files for job applicants, contractors, volunteers, and others. It's not just your staff, right? So keep them separate from the personnel files, but organized in such a way that the surveyors can look at them. What are the surveyors going to be looking for? CMS has said that compliance is going to be assessed during complaint surveys related to, obviously, the vaccinations, and also your annual recertification surveys. Among the things that they're going to look at are your vaccination policies and procedures, including your plan for vaccinating staff, providing exemptions, and tracking staff vaccinations. They're going to ask for a number of your resident and staff COVID-19 cases over the past 4 weeks, a list of all staff and their vaccination status, and they're also going to conduct interviews and observations. It's going to be a nightmare. It's for you to keep track of all this stuff. I think it's easy to keep track of the vaccination status of your employees, but what are you doing about your medical director, your attending physicians, nurse practitioners, and other people, volunteers, board members, folks who are coming into your building to provide services on a regular basis? You're going to have to have a system for tracking all of this information. The regulations also provide a very detailed description of the components of your required policies and procedures. Some of the things that you're going to have in your policy. What's your process for ensuring all staff, except for staff who have pending requests for or who have been granted exemptions or for whom COVID-19 vaccination must be temporarily delayed, What's your process for ensuring that those staff have received the first dose of their vaccine prior to them providing any care, treatment, or other services by December 6th? What's your process for ensuring all staff, and again, the only exemption here is for whom vaccination must be temporarily delayed, are fully vaccinated by January 4? Now, again, that's going to include people who have been approved for granted an exemption in that second phase. Process for ensuring the implementation of additional precautions to mitigate transmission and spread of COVID-19 for all staff who are not fully vaccinated. Those are those accommodations. In there, think about how you're going to make sure that your supervisory staff on a need-to-know basis know who they need to be watching to make sure that they are following your accommodation requirements in such a way as to not jeopardize the confidentiality of that information. What's your process for tracking and securely documenting the vaccination status of all staff? And here's a real interesting one. In addition to your first dose and your second dose, if you're on a 2-dose regimen, they want you to have a process for tracking and documenting the status of any staff who have obtained any booster doses. What's your process by which staff may request an exemption? A process for tracking and documenting information for staff who have requested and been granted an exemption. Process for ensuring that requests for medical exemptions include all required information. And on that, remember, those forms have to be signed and dated by the licensed practitioner. Process for ensuring the tracking and secure documentation of the status of staff for whom the vaccination must be temporarily delayed, and contingency plans for staff who are not fully vaccinated for COVID-19. What are some of the acceptable proofs of vaccination? I'm not going to read through this, but it's here for your record. Just asking somebody to sign an acknowledgement that they have been vaccinated is not going to work. Attestations aren't going to work. They want some third-party verification of the vaccination. So what are some of the best practices related to compliance with this? In addition to doing all this, I would urge you to update your facility assessment, update your disaster plans, and update your COVID-19 safety plans to make sure these elements are reflected in those other documents. Because I do think if I'm a surveyor and I'm looking for low-hanging fruit, I'm going to be looking in these 3 areas as well. To mandate or not to mandate. For those of you who are part of larger organizations, you've got elements right now that fall outside of the CMS regulations. If you've got more than 100 employees overall, you're going to be subject to the OSHA ETS as well. How many employees do you have? Where do they work? How's your campus arranged? We're still waiting for the Department of Human Services and PA to say what their expectations are with respect to vaccination. The OSHA ETS for large employers, as I mentioned, has been stayed right now, but the fate's uncertain. The ETS on its face does not apply to healthcare providers who are covered by the CMS Interim Final Rule, which we've talked about. It also does not apply to employers who provide healthcare services or healthcare support services subject to the first ETS that we talked about at the beginning. And it does not apply to workplaces covered under the Safer Federal Workforce Task Force COVID-19 Workplace Safety guidance for federal contractors and subcontractors. Having said that, if you're a mixed, what I'll just call a mixed use, practically it may be easier to do a straight vaccine mandate, because you're going to be treating all of your employees equally, and you're not going to be creating an incentive for your employees to flee out of your skilled nursing home into other aspects of your organization. The OSHA ETS gives employers more options than the CMS Interim Final Rule. You're required to develop, implement, and enforce workplace policies to either require mandatory vaccinations, or you can permit employees to choose to be vaccinated, and unvaccinated employees would be required to wear face coverings indoors or when in a vehicle with another person for work, test at least weekly if they're working in the workplace, or test within 7 days before returning to work, away for 1 week or longer from work. There's a lot more in the OSHA large employer ETS. Much of it mirrors the requirements that we talked about back in June and July when the healthcare ETS, the COVID ETS came out for healthcare employers. So I'm not going to spend any time going through that at this point, but I did want to end with a slide from OSHA that sort of lays out the requirements under the large employer ETS in the event that that does go into effect. And on that note, I'm going to take questions, Wendy, if there are any. I hope people found this helpful. It's a lot to cover, I know.
Yes, most definitely. Thank you so much. That was a lot of information, and we do have some questions that are already in, and we will take those. And any more, if you have questions for Paula, please type them in the question pane and we will get to them. The first one I believe we've already covered. So Sheila, if Paula did not answer your question here, please retype, a question. But this one is, what is the criteria for medical and or religious exemption? Can staff just say that for religious beliefs? How is this going to work?
So we have talked about the medical requirements, and they're pretty clear. In terms of the religious belief, you can't just say it's against my religion. You've got to make some sort of inquiry. We are suggesting that people develop a COVID religious exemption request form so that you are asking all of your employees to provide the same type of information. Some of that information is, what's the nature of your religious belief? How will taking the vaccine conflict with that religious belief? Some folks are asking, how long have you held that religious belief? You can't require them to bring in a note signed by the clergy or their pastor, their minister, or their rabbi, because again, this is a personal belief. It can be outside of mainstream religion. It really is going to depend on the nature of their belief. Having said that, there's a lot of flexibility, and there's two schools of belief, if you will. There are some people who are saying, we're not accepting any religious beliefs. We can't accommodate them. It's an undue burden on us as the employer. It's too great of a risk for our patients, our residents. And then there are others who are saying, if it looks like a sincerely held religious belief or observance, we're going to accept that because we don't want our staff to leave. Now, the one thing you cannot do is run out and say to your staff, oh, yeah, you don't have to get vaccinated, give me a religious exemption request. You have to go through and actually do an analysis because, like I said, The surveyors are going to come in, they're going to be looking at these things, and they're going to look to make sure that you're following your policies and procedures with respect to processing both the religious and the medical exemption requests.
Okay. Regarding, hold on one second, let's go up here. Can you address agency staff and how to handle agency staffing?
That's a great question. I would be working with those agencies to have them require people that they're bringing into my building to be vaccinated, or to give proof of an exemption, because you're going to be held responsible by the department and CMS to ensure that people who are coming in as contracted staff are vaccinated. And I would try, if you can, to amend contracts with anyone who's providing you staffing to try and include those requirements and push it off on them. The other piece, though, and I'm hearing people going both ways. There are some folks who are saying, if you have been granted a religious or medical exemption by your employer and you're coming into my building, I am going to accept that. And others who are saying, if you're coming into my building and you're not vaccinated, I'm going to ask you to provide me with a request for a medical or religious exemption so I can see if it's an undue burden for me, an undue hardship, and if I'm going to accept that request. And until we get further guidance from CMS, I can't say one is right and the other isn't.
Okay, moving on to pharmacy delivery personnel who come into the building. How should that be handled?
The same way, the example that CMS gave yesterday is specifically on, pharmacies who are personnel who are coming into a covered building, right? The pharmacy itself is not covered. It's not regulated by CMS for health and safety standards. But if its employees are coming into your building, you should make sure that they're complying with your policies and procedures.
Okay. How is practitioner defined?
I would have to go back and look. If you're talking about practitioner in terms of the medical exemption, it would be someone who's acting within the scope of their practice, and whether or not they could be someone to sign off on that medical exemption form, if that's what the question is. So for instance, I doubt that a physical therapist would be able to give you that medical exemption, but a nurse practitioner might be able to do that. It does not necessarily require a physician.
Okay, the next question we have, which vendors does the vaccination mandate apply to? Does a vendor doing landscaping or filling the soda machine need to be vaccinated?
Landscaper, probably not, unless they're coming into contact. So for instance, if your landscaper you have a secured courtyard, and the landscaper is coming every Wednesday, and that Wednesday happens to be your group singing gathering in that same location, I think CMS might make an argument that the landscaper has to be vaccinated. If, on the other hand, the landscaper is outside, not coming into contact with folks, he's coming in to snowplow or put salt down on the ice, probably not. the same thing, same analysis with the guy coming in to fill the soda machine. Where is it? Who's he coming into contact with? How regularly is he coming in? I think you can create your policies and procedures to analyze the risk and have a reason for why you are or are not including those one-off vendors and contractors until CMS comes out with further guidance. The examples I used on my slides are right out of the preamble, particularly, the example of the guy who comes in once a year to test your elevators, and CMS has said that doesn't need to be vaccinated.
All right, we're moving on to our next question. Can you please address current staff that are unvaccinated that have had COVID within the last 90 days? If an unvaccinated staff member is still within the 90 days since being COVID positive and not able to receive their first vaccine by December 5th, can the staff member continue to work?
So the staff member can be vaccinated even if they've had COVID within 90 days. I think you're confusing the requirements to have that person tested under the PA-HAN and the CDC guidelines. If the worker has a clinical contraindication for a limited period of time, that person can be allowed to work. And those were the examples we talked about in the slide, where even if somebody was due to have their final fully vaccinated shot by January 4th, and there were clinical reasons that would be recognized by CDC as a reason to delay the shot, they would not have to be prevented from working. You would have to make sure that you were giving them appropriate accommodation mitigation standards, but I'm not sure that having had COVID within the past 90 days is a contraindication for getting the vaccine. I think it is something that gives you the ability to not test somebody, but I'm not sure that's a clinical contraindication. And if it is, and I could be wrong, then there is a provision that would allow that person to continue to work. And that would fall as well, though, in your policies and procedures and documentation requirements to show how you're tracking to make sure that when that contraindication that allows that delay expires, that you're circling back with that individual to make sure they're getting vaccinated timely.
Okay, the next question: for personal care homes in the same building as a SNF with less than 100 employees, will all employees also need to follow CMS guidelines?
In that case, I would say yes, because the likelihood of staff coming into contact or residents coming into contact in that contiguous setting, even though the personal care home would not otherwise be qualified, would not otherwise fall under either of these requirements right now. The fact that there's that ability for cross-pollination would suggest that just like your pharmacist who's coming into your building who's not otherwise covered, those staff should also be vaccinated.
All right. We still have questions. Go ahead.
I have a 3 o'clock meeting that I need to hop off for. If there are additional questions, can you send them to me and we'll draft up something?
Absolutely. Yep, we will certainly do that. All right. Well, thank you, Paula. We appreciate you today, and we'll get those questions over to Paula so that she can answer them, and we'll get those out to you as soon as possible. If you do have any other questions, feel free to send them to us here at the association, and we will add them to the list. Just want to wish everybody a great remainder to your day, and again, thank you to Paula for the information, and we'll continue to keep everyone up to date as things change and come into play.
Okay, thanks so much, everybody. Stay well.